Hi, this is Dr. Silvester, and I'm going to talk to you today about the importance of postoperative compliance. This video is for patients that are considering having surgery or have had surgery in our office, and I want to tell you that they're about half the surgery, half the successful outcome is our responsibility, making sure the surgery is done correctly and the fixation's in place, and just doing the mechanical things of trying to make it successful, and half the surgery success is your responsibility, and that's keeping the swelling down, doing the therapy that you need. First thing that we tell all of our patients for most foot surgery that we do is go home, lay down, and keep your foot elevated for 4 or 5 days. And what that means is the following. Elevated means above your head is better than above your heart, which is better than above your hip. And so what happens is if you keep your foot elevated, it doesn't swell up. The miracle that happens in that is that you don't have a lot of pain. Most people think that the pain occurs because of the surgery. It's really not the surgery that causes a lot of the pain. The majority of the pain occurs because of the swelling that occurs after the surgery because of the trauma that's been done. There's also, you want to pay attention to how the dressing feels. If it feels tight, if it feels like it's not, let's say you're having pain and it feels like it's too tight and the pain medication isn't working, call us and let us know, because it's not good to have a dressing that's too tight, but you want to have it somewhat snug to keep the swelling down as well. Secondly, we tell patients to keep their medications going. We have postoperative medications that we give patients. Some of them are antibiotics in some cases, some of them have pain medication in some cases. Go ahead and take them. If you're experiencing the antibiotics, you want to take according to instructions. The pain medication, if you're having any pain at all, go ahead and take them. If you're not having any pain, you don't need to. Other things, after a few days, after a couple of weeks, if we take your stitches out and everything's going well, if we give you exercises to do, it is extremely important that you do those exercises because they will help the mobility, keep the swelling down, keep your pain down. A lot of people don't understand that by moving a toe after surgery, let's say you have a bunion surgery, if you start moving that toe regularly and frequently, the pain is less than if you just leave it sit after a few days, after the skin incision heals up. I just had a lady, I saw her in church yesterday. She's a patient of mine that I operated on, and she ran 2 miles the day before I saw her, and she's about 4.5 weeks after her surgery, which is probably a little early, but because she's been doing a lot of therapy, she feels good. Her foot doesn't swell up. She's comfortable. She has it in a regular shoe, and she's very happy with the results. I have other patients who don't move their feet and won't do their therapy because it hurts a little bit, who take months to get to that level. So it's important to go through the therapy as you're directed. If we advise it, if you live nearby, we like to do electrical stimulation post-operatively to our patients, and that helps them feel better in a much quicker way. Basically, follow the doctor's instructions. No matter what surgery you're having, doctors don't tell you instructions just to make you uncomfortable or to make you're miserable. We really want you to have the most pleasant experience post-operatively as you can, and by following those instructions you can have a much more, not only much less pain post-operatively, but also a much more successful outcome for your surgery, and it does have a big effect. So keep that in mind. If you're considering surgery, one advice I give my patients, all of them, if you cannot do the recovery, don't do the surgery. Thanks for listening.